Hi, good morning. Myself, Dr. Lokesh. I'm a consultant neurologist at Aster CMI Hospital, Bangalore. Today, we're going to talk on a subject called neurosonology. What is neurosonology? It is a point of care ultrasound in clinical neurology. I would say like it is an extension of our clinical examination, and this includes transcranial Doppler, carotid duplex, peripheral nerve, and muscle ultrasound. Right. So we have the way we evaluate neurological patients is clinical examination, and then added to that we use investigations like MRI, then we have CT scan, then we have nerve connection studies. Now the ultrasound is a new entrant where it is like a fifth dimension to our clinical examination, or we use the electrophysiological testing where we can visualize the areas of interest. So today we'll be taking over through the different aspects of the various procedures that we do in neurosonology and all our bedside investigation. I will briefly talking about different techniques, and we'll be live demonstrating on this. This is the transcranial Doppler machine, and so this is 2 to 4 megahertz pencil-like probe which is going to capture the ultrasonic waves from the brain, and the physiological parameters that we will be recording using this machine is mean flow velocity, peak systolic and end diastolic velocity, and pulsality index. Now the second machine that we will be using is a regular ultrasound machine. So here we have two probes. One is a linear probe 12 to 3 megahertz where we do the carotid duplex, and also it is used for muscle and nerve ultrasound. And we have a specialized probe called as a hockey stick probe, which is a high frequency probe which has got a very good resolution for peripheral nerves. And the advantage of this probe is it has got a very small footprint where it can easily fit in the ulnar circles and those areas where we can track the nerve, which I will be demonstrating shortly. And also we use curvilinear probe for the sciatic nerve. So we will demonstrate how we perform a transcranial Doppler. So we use this transducer, and here we have a volunteer. So there are certain areas in the brain through which we can transmit the ultrasound waves. One of those areas are the transtemporal area, so where we have the skull, which is slightly thinner, and the next area is just beneath the mastoid, so where we can insonate the vertebral artery, and then we have the suboccipital region where we can insonate the basilar artery. Right now, how do we identify the vessel? We need to apply a gel so for the ultrasound waves to be transmitted, and we need to place over the transtemporal region. So there are two screens that we see. This is called as an M mode screen. So in the M mode, we see this color of red and blue, right? Red means the waves are transmitting towards the transducer, and blue means the waves are transmitting away from the transducer, right? Now, how do we say that the insulated vessel is a middle cerebral artery or anterior cerebral artery? So it depends upon the depth in which we are acquiring the signal. So any signal that is obtained from say some 50 to 65 millimeters, so usually it is in the vicinity of the middle cerebral artery, and above 70 it will be in the vicinity of the anterior cerebral artery. So as you know, in the anatomy, is the middle cerebral artery, the flow is towards the transducer, and anterior cerebral artery is away from the transducer. We get this red and blue signal. So over the screen, so you see that we can see a nice waveform. This waveform is of the middle cerebral artery, and the parameters, as I mentioned, is the mean flow velocity, and 87 is peak systolic, and 38 is end diastolic velocity, and pi is the pulsality index, right? So in the same way, for insulating the vertebral artery. We place the transducer in the just beneath the mastoid, and then we need to angulate. So now you see the entire screen as blue because here when I'm insunating the vertebral artery, the flow is away from the transducer, and so we record again the mean flow velocity and the pulsatility index and the end diastolic velocity. And similarly for the basilar, so we go through the suboccipital route. So what are the application of transcranial Doppler? So there's a lot of people ask me this when we have a MR angio, when we have a CT angio, what is the additional information that we can obtain by transcranial Doppler? So one is transcranial Doppler gives us the physiological information about the cerebrocirculatory status. It tells us about the mean flow velocities, and most importantly, the information that we obtain by pulsatility index. It tells us about what is the cerebrovascular resistance, right? So it can add on to the information that we obtain from MR angio and CT angio by one thing, by physiologically monitoring these patients over a period of time, and then in the ICU where we have to look for raised intracranial tension, we can monitor the pulsatility index over the time period. And for diagnostic like stroke prevention clinics, we can look for any intracranial atherosclerosis, which is reflected by increase in mean flow velocities, and in cerebrocirculatory arrest or brain death, absent of end diastolic flow, and patients who are having a plaque on the carotids. So we want to know whether there is an artery to artery embolus. We can look for embolia monitoring, and in case of carotid stenosis, we can look for cerebrovascular reserve by doing a breath holding index. So these are some of the various applications of transcranial Doppler which can complement our MR angio and CT angio. So this is the carotid duplex. As I mentioned earlier, we are using the 12.3 megahertz linear probe, and we place the probe on the neck, and as you see on the screen, so this is the vessel, that is a common carotid artery, and the one which we can just compress is the jugular vein. And as we just move up proximally, the vessel enlarges. There's a carotid bulb and it divides into two. So one is the external and one is the internal. So we can acquire the images in the longitudinal, and what we'll be interested to see here is, so we can look for presence of a plaque, we can look for any narrowing of the lumen, and once we apply a color, we can look for the flow dynamics, and this is a pulse wave Doppler. So with this we get information about is peak systolic velocity and the end diastolic velocity. Application of carotid duplex. This is one of the bedside non-invasive portable investigation where you can actually look at the lumen. Unlike MR angio and CT angio, which is going to give you a luminology, the carotid duplex tells us about the status of the vessel. It is like imaging the vessel in real time, and what all the pathology that we can see is, we can look for intima media thickness, which is the main cause of atherosclerosis. We can look for any plaques, and then we can quantify plaques, and most importantly we can follow these patients on a regular basis. And just like how we do a treadmill test, or we do a coronary artery evaluation, for cerebrovascular evaluation, carotid duplex plays a very important role, where presence of atheromatous plaque is a significant sign of atherosclerosis, and that will in turn help us in risk factor modification, or whether the patient needs statins or antiplatelets. So these are the bedside applications for carotid duplex. So one of the novel application of neurosonology is a tracking of peripheral nerves. So this is a hockey stick probe which I had mentioned earlier, and so far the evaluation of peripheral nerve disorders has been clinical examination and nerve connection studies. Now with this neurosonological application, there's a peripheral nerve ultrasound, we can visualize the nerve. So I'm just running over this, placing this ultrasound probe over the medial epicondyle, and there is the location of the ulnar nerve. And what we do is we track the nerve both distally and proximally. Okay, so now we can just have a look on the screen here. So in the screen we see this is my arrow pointing out. That's the location of the bone. There's a medial epicondyle, and we can see this is hypoechoic structure. So that is the ulnar nerve. So you can just trace the nerve, and so we can see the fascicular architecture, and these are the ones, the hypoechoic structures or the muscles around it, and we track the nerve from all the way from the wrist up to the axilla, right? And how do we know the nerve is enlarged or when the nerve is normal? So we record the circumference area, the cross-sectional area of the nerve at predetermined areas, and this we have this eclipse tool here in this ultrasound, which is going to automatically tell us about the cross-sectional area of the nerve. In this case, it is 0.080 centimeter square or 8 millimeter square. So this is a novel application which complements our clinical and electrophysiological testings. You saw all the various procedures and techniques that what it encompasses, what we call as a neurosonology, that includes transcranial Doppler, carotid duplex, and peripheral nerve and muscle ultrasound, and it is used for diagnostics and as well as for a therapeutic purpose, specifically in peripheral nerve ultrasound, where we can do ultrasound guided procedures for carpal tunnel syndrome and myalgia parastatica. So this is a new field that is it's a point of care ultrasound that is going to give us an additional dimension into our routine clinical examination, results of which is going to make a big difference in terms of the diagnosis and treatment. Thank you for patiently listening to this very short video about neurosonology. Thank you.